from the Oncology Institute, Serbia, and the presentation is titled Digital Mammography in Comparison with Digital Breast Tomosynthesis, Detection of Multicentric Breast Cancer. Thank you.
Thank you. Multicentric and multifocal breast cancer were defined as more than one lesion in the same quadrant or in separate breast quadrant, respectively. Multicentricity and multifocality in breast cancer are relatively frequent, about 24–25% in grade series. All we know is that magnetic resonance imaging is a method of choice in multicentric breast cancer diagnosis. In this study, we only include multicentric, not multifocal breast cancers. The aim of this study was to demonstrate the diagnostic significance of digital mammography or 2D mammography versus tomosynthesis or 3D mammography in the group of histologically proven multicentric breast cancer. This was a prospective study of symptomatic and asymptomatic women from primary care because there is no organized screening in my country. 110 patients with breast cancer with multicentric breast cancer were examined with mostly ECR 2 or 3 type of breast pattern. All patients were histologically proven that have a cancer with core biopsy, vacuum-assisted biopsy, or a surgical biopsy. All the reports were classified in this group as BI-RADS 4 or BI-RADS 5 category. We performed the 2D and 3D mammography in the same act on hologic cell linear dimension system with this technical data in 2 standard views, MLO and CC. This is a case of a 54-year-old patient without any symptoms. On 2D mammography, no obvious mass. On MLO, we can imagine many different architectural distortion zone, but on CC view, we are not sure that there is anything. But when we performed 3D mammography, we notice 2 stellate lesions, one in upper and another one in outer medial part of right breast. Another case is a 47-year-old patient with palpable mass in upper medial quadrant of a right breast. On 2D mammography, we clearly can see that stellate lesion, that mass. But when we performed the 3D mammography, we noticed, we clearly see 2 additional small stellate lesions, which were in outer upper quadrant, and this one bigger is in medial part of right breast. Concordant and discordant result between 2D and 3D mammography in this study were shown on this table, where we examined 110 patients with 152 cancers. 82% of cancers were detected on both methods. Additional 10% of cancers we noticed only on 3D mammography, and in 6% of patients on both methods the results were false negative. When we analyze the diagnostic performance of 2D and 3D mammography, we have overall sensitivity in multicentric cancer detection of 82% on the digital mammography and 94% on 3D mammography. We can conclude that in this study, 3D mammography was more sensitive than 2D mammography for detection of multicentric malignant foci in dominantly heterogeneously dense breast. These authors, thank you for attention.
Thank you very much for your talk, Dr. Prvulović. Can I invite anyone to raise a question? Thank you. We have one at the back there.
Hello, Mihail from Romania. I wanted to ask you, you have done tomosynthesis only on oblique views?
No, we performed both the projections, MLO and CC, in the same act, so we used the combo technique.
Okay, yes, but I thought that you use only, because sometimes it's very difficult to localize the lesions using only one tomosynthesis view, and after that to see where is, on CC view.
No, we always use both projections.
Okay, I didn't understand very well when you...
Okay.
Thank you. Are there any other questions from the audience?
Or you could explain the high rate of the false negative cases?
All these cancers were histologically proven, so when we compare histological finding and have a second look on 2D or 3D mammography, we cannot find that cancers. So we said it's that our images are false negative. We cannot find that focus of cancers.
Did you follow up, or was it just how long did you wait for the? You said you couldn't find them. Was that just a? Did you do a follow-up test afterwards?
This is only a small part of a big study of cancer with patients with proven cancer. So we didn't finish that study yet.
Okay, thank you very much.
Thank you.